My name is Ishan Mosin. I'm the Director of Pre-Nursing and Pre-Physician Assistant Programming. First off, I'd like to thank AAMC for sponsoring our conference. Without their support, this event would not have been possible. Our next speaker started out in his early years with the understanding of society's responsibility in healthcare. He took this understanding along with his passion for science through college and medical school. He became active within the student body at George Washington University School of Medicine in response to the changing healthcare policies at the time. Through his residency in California, he also developed an interest in academic medicine. While continuing to follow his passion for scientific research, he also became involved in consulting, healthcare policy, healthcare economics in both private institutions and the federal government. He began working for AAMC, where he helped create and implement policies for academic institutions that will positively impact public health overall. He has been featured in many interviews, radio talk shows, podcasts, and national television, including C-SPAN, where he speaks about upcoming changes in medical education and health policy. It is my greatest pleasure to introduce to you the Chief Public Policy Officer of the Association of American Medical Colleges, Dr. Atul Grover.
So as you heard, AAMC is a sponsor of the conference. We're very happy to be here. That's the only reason they allowed me to speak to you. I think I am really honored to share the stage with folks like Jim Madera and Bob that just spoke with you, and Admiral Nathan, Secretary McDonald. It's a great privilege to follow them and to be on the same program. I want to talk to you a little bit about how I got here and what it means to be a physician, what it means to be in healthcare, and kind of what inspired me, and I hope will inspire you as you go through your careers. And you can pretty much ignore anything I'm going to show you in the slides. There will not be a test on this later on. There's nothing you need to remember except there are many, many pathways to get into healthcare and into medicine. There is no one right pathway, and all of you bring unique skills that are going to improve the lives of hundreds of thousands of patients and people in your communities. The second is that, and I think this really echoes what some of the other speakers have said, that there are people like me and other people that are on this stage that are invested in your success. We want to help you succeed. We are always willing to take a phone call or an email to try and figure out how we can help you think about that next path or the next 5 paths in your career. Every one of us is here because we're invested in you. And thirdly, that there are organizations like the AAMC that are also invested in you and trying to figure out how we help you succeed as you go through your career, whether or not you go into academic medicine or into private practice or you do policy and push paper around like me. We're still here to help you. And AAMC is a pretty amazing place. We get to work with folks like the dean here, Julie, who you heard from this morning, all of our medical schools, our hospitals and health systems, you as future students and residents, and also our faculty and researchers, of which there are at any given time 300,000 physicians to be that are training other physicians or physicians in training themselves in our institutions. And we provide about 20% of all the clinical care in the country. There are lots of different ways to get here. If you like a challenge, healthcare and medicine are a fantastic opportunity. If you're worried about that next step, remember, think beyond it. It's not just about the MCAT. It's not just about getting into medical school. It's about spending your life doing something that you actually have fun at. And that's incredibly important as you help other people along the way. So here's my own journey, and I can't believe I actually gave these pictures to my colleagues to make this slide, but I also am the child of immigrants, and so I went from playing violin at the age of 13 to fronting a rock band towards the end of high school, towards my colleague, and I was just speaking with Admiral Nathan over there about my good friend Brad, who is in the Navy as a physician now, and there we are outside his family's boat, and another Navy doc friend of mine when I was a graduate student and with my parents during one of my graduations. And it was a very, very serendipitous but sometimes circuitous route. So I grew up in a family that valued education and public health. My father was an epidemiologist. I went to college thinking I was going to be a scientist. I lasted about 3 weeks in a biology class that was a big classroom like this auditorium, and I said, I can't do this. I can't sit in these classes, probably my ADD coming out at a very, very late age. But what I did find was that I still loved the idea of taking care of people, but I couldn't stand the process and how to get there. So every step along the way, you're going to feel that pain of the process. And I will take some of the credit for your agony working for the organization that administers the MCAT, and I apologize in advance. But it's worth it. You've got to stay on track and think about what you're going to be doing improving the lives of people in your community for many, many years to come. So I sort of stayed the course and decided that I could get a degree in poetry. Yes, I have a degree in poetry from Cornell University, which is very similar to Davis in that we had cows and horses on our campus too. It was a lot of fun. And I actually took horseback riding for PE. And those are the kind of things that you got to remember to do along the way, because it's a busy life when you become a physician or a nurse or a dentist or anything else in healthcare. And I thought about getting a master's in fine arts, but I realized that I wanted to keep writing, I wanted to teach, I wanted to do a little bit of science, and I wanted to take care of people. And so there was really nothing better for flexibility in your career than becoming an MD, because people, for better or worse, will assume that you're smart and hardworking. And I can guarantee you that's not universally the case. I also was fortunate enough to pay for my medical school through a National Health Service Corps scholarship. Now, most of these are actually loan or payment programs now, but again, if you're interested in serving the underserved, it's a great way to go. Military scholarships as well are great ways to afford you the opportunity to become a physician and pay off that unfortunate debt that, as of right now, you still have to live with. And I was very lucky, because I was interested in public health and in health services research and economics, to be able to go and do a fellowship at Johns Hopkins. And you know what? I asked, and they gave me a PhD, and they paid for it through another government program. So I would encourage you to think about all these different options along the way. There is no one right path, and you are going to all bring something to healthcare that is uniquely different and will benefit the patients that you take care of for years to come. And that's going to be important, because there are a lot of challenges in healthcare now. We talk increasingly about the $3 trillion in this country that we spend, and I won't go off on a rant about this, but we have a habit in this country of ignoring people from birth to 64 and then throwing the kitchen sink at them when they turn 65. That's something you all will need to work on as you move through the healthcare system. How do we actually create a culture of health and not just a culture of care for the ill? How do you work in a team? Because medicine is no longer a sport dominated by gladiators and people who think that they are always the captain. Sometimes somebody else other than the physician needs to lead, and that's okay. And increasingly, you are going to be part of those teams no matter what role you have and what specific title you have. It's going to be worth it. We are now, I finished my training 20 years ago when I could say, hey, I trained at the University of California, San Francisco. I'm infallible. I had great training, I must be a great physician. Not necessarily the case. And so we're going to measure each other, as well we should, as well as what the public expects from us is increasingly changing. And patients are going to become active partners, not just the people that we tell what to do and how to do it. Yes, their behavior makes a difference, but in fact, it's up to us to help them understand how their behavior will affect not only their health, but the health of their families. And the opportunities, again, are really just tremendous. Many of you, I hope, will actually pursue a career not just in clinical science, but also in scientific research. Unfortunately, we have been the victim of a sort of zero-sum budget in Washington these days, where we have failed to invest in scientific research, but I don't think that's a sustainable path either. Sometimes you have to spend money to make discoveries to actually improve the health of the nation. And back to the MCAT, which again I apologize for. We are trying desperately to figure out how we don't just measure you as potential physicians on your MCAT scores or your GPAs. We're figuring out how to do situational judgment tests, how to do multiple mini interviews. If you go to the AAMC booth here, you'll hear and learn a lot more about those services. But we're trying to figure out not just who's got the grades to become a good doctor, but who do I actually want taking care of me and my family and my children? And sometimes that's not best dictated by what you got on the MCAT. So we're trying to improve these tools. The new MCAT will start in the next spring of 2015. It will measure social and behavioral sciences. It's a little longer. Again, I apologize for that. But we are trying to figure out how we assess you in many different ways. And I think historically, we've really gone from people who have the best test scores and said they're going to be the best doctors. Now we're really trying to figure out how we judge you as people, as potential clinicians, as our partners that we're going to work with for the next 30 years to take care of, again, my parents and my children. One of the ways we're doing that is really trying to figure out how we kind of flip the model, even on admissions. So how do we include things like the MCAT in your GPA, but how do we really start with you as a person and what kind of physician you'll make? All of that is going to take some time, and I think that Dr. Madera talked about what some of the efforts of our schools are in trying to move this process forward, but certainly all of these things are going to move the ball a little further ahead, one step at a time. The writing sample has also gone from the MCAT, which some of you may be happy to hear about. There is an official MCAT guide. There are Khan Academy videos that will help prep you for these things. We've had great contests, great success, where your peers are actually out there creating content for you to do better on the MCAT without having necessarily to pay for some of these practice tests, but they are available as well. In terms of money, unfortunately, the average physician will graduate now with a debt of about $170,000 to $180,000. I had a great friend and mentor named John Eisenberg, who was one of the early directors of the Agency for Healthcare Research and Quality. And I remember complaining to him one day about the debt of medical students, and he said, Atul, most Americans, if you told them, make a $100,000 investment in your education, and I guarantee you a six-figure income for the rest of your life, would take that deal. So I would say medicine is still a great deal, and although the debt is daunting, it's manageable. And there are lots of tools to help you figure out how you manage that debt. If you go to the first portion of our website, there are loan calculators, there are links to scholarship programs and loan repayment programs. And what I would also say is make a plug for, again, Admiral Nathan, the Secretary of the VA, Mr. McDonald, NIH, Indian Health Service, Public Health Service. There are lots of programs out there to help you manage that debt and serve your communities. I chose to serve my community in a different way by going more of the policy route, but all of this is valuable. And so I'll bring this back to the idea that there are many ways to complete this journey. There are many different paths to becoming a physician or a nurse or a dentist or anything else. In the end, it's about what you do every day that you find joy in. And remember, seek people out as mentors. We are here to help you. We are invested in you. And I work for an organization that is heavily invested in you as future physicians. So with that, I will stop. Thank you very much. Visit the AAMC booth. And oh yes, follow us on Twitter. And if you're interested in policy, you can download the app from either the Android or iOS store. The other thing I will tell you is we're going to enlist you in our advocacy army coming in November. One of the things that's a priority for us is ensuring that if you go into medicine, you have a residency position that's actually funded and that you can complete your training. So keep an eye out for that. Again, sign up on the website, and thank you very much for having me here today.